Hi everyone, I'm Paige Abbott, and this is your weekly recovery message on the topic of disease messages. Interesting. What does that even mean? Well, I know that a lot of people talk about addiction being a disease of deceit. Lots of lies, promises that aren't followed through on, things like that. But I find in these discussions, people are often focused on the lies or the untruths that are verbalized. What about the stories and the messages that happen internally? There's a great book called Addictive Thinking, written by Dr. Abraham Tversky, and that's exactly the content and the focus of this book, is looking at essentially the cognitive or thought-based symptoms of addiction. And in my clinical work, I believe it's so important for individuals to learn about addiction at that level, not just in theory, but in practicality. So really going within and exploring what are the stories, what are the messages, what are the ways that addiction prompts people to think, whether about themselves, about others, about situations, and to then start to tease apart what are self-thoughts and what are true thoughts from what are the disease messages. Some very common disease messages in the realm of self, lots of shame, self-blame, self-doubt, worthless, judgment, criticism, lots of unhealthy, unrealistic thinking, but it happens so often and so frequently that it starts to sound and become true. But it is important to really try and push through and recognize the storytelling that's occurring rather than accept what the brain is saying as truth. The more addiction can drive shame and self-doubt, the more influence it has. Meaning shame does provide a dopamine hit. So the worse you feel subjectively, unfortunately, your brain may be getting a hit off of that. And so this in and of itself can fuel the disease even without any external influence of substance. What are some disease messages that get focused externally? Well, the most common is any sort of judgment or criticism that you feel towards other people. So viewing them in a certain way, thinking a certain way about things that other people have done or not done. This can happen even in the context of recovery, that being in a 12-step meeting, you hear something and instantly feel judgmental or critical or feel different than the person who's sharing. It's important to listen for the similarities. Often those messages are trying to create a segregation between you and those other people when in fact there isn't any. You are them, they are you, their story is your story, maybe a little bit different or slightly different situation, but the undercurrent is the same. Get to know the disease message. That's the bottom line that I hope you can take away from this. If you're confused and unclear, you may want to read the Addictive Thinking book or reread it and have conversations with others in recovery about what they have noticed. How does the disease of addiction prompt them to think and respond towards themselves and other people, and get to know those disease messages? Because in doing that, you can then start to become clear on where are you in all of that rather than buying into the stories of the disease. Thanks for watching. Take care in your recovery.